Yeah, hello, good evening. This is Dr. Trudy, and today I'm going to be discussing the fertility window. The fertility window. Fertility window is a very important concept in the process of fertilization and conception. Let me just quickly have a quick overview of how you achieve pregnancy. To achieve pregnancy, there must be a union of the egg and the sperm. The sperm would have been deposited in the vagina and the egg would have been released from the ovaries. Normally, the eggs are housed in the follicles. The follicles are like eggs. The follicles are like vehicles where you release the egg. And the process of release of the egg is called ovulation. So fertility window is simply the best time to try and conceive. So it's a kind of a range of days you have the best chance, the best potential, the best probability of achieving pregnancy. This actually it's variable, so you have to be very careful. And the right time for you might not be the right time for the other person, but you just have to be very conversant with your menstrual cycle. Your menstrual cycle is actually the determining factor in figuring out when your fertility window is. This window are days in a woman's cycle when the pregnancy chances are possible. It's very important you know that pregnancy is technically and scientifically only possible during the first 5 days before ovulation. So, practically, the fertility window starts 5 days before ovulation starts. The reason why we use 5 days before ovulation as the starting point is because the sperm, which is a must in this whole process, can survive up to 5 days when deposited inside the woman's vagina. So, practically, if you meet with your partner and everything is okay, 5 days before you ovulate, that sperm has a potential of getting you pregnant. But the nearer to the ovulation you have your sexual intercourse with your partner, the better the chance of you getting pregnant. In the other vein, the egg survives up to 12 to 40 to 24 hours once it's released. So you can see the difference between the sperm. The sperm can actually be viable up to 5 days before ovulation, whereas the eggs can only have a time lag of 24 hours. So the fertility window starts 5 days, then the day of ovulation, and a day after the ovulation. So that's the range, that's the theoretical range, that's the theoretical period you have a greater chance of becoming pregnant. The key thing to note in pinpointing when you can have your ovulation and your fertility window is to know your cycle. When you know your menstrual cycle, like the normal one we use for our teaching is 28 days. So if your menstrual cycle is 28 days, chances are that you're going to have your ovulation on day 14. So your window opens 5 days before that, your day 14. So let's use, for example, you started having your bleeding 1st of January 2018, and you have a 28-day cycle. So tentatively, on the 14th of January will be the period you will have your ovulation. That's the day you will likely release an egg from your ovaries. So if you count 5 days before day 14, that's actually when your fertility window opens. So you have a chance of becoming pregnant if you engage in unprotected sex with your partner from 5 days to that day 14 up to the day 15. But it has to be in a regular predictive cycle. If you don't have a regular cycle, if your cycle plays tricks on you, this formula might not work for you. But what you need to do is to make sure you at least have an idea about the time because it can fluctuate. So a woman can actually have 28-day cycle this month, then the upper month she can have 29, she can have 30, so it can fluctuate. So make provisions when you're doing all these calculations for plus or minus 2, 3 days. So don't be rigid when you're trying to have, achieve success. Try and have a leeway, try and have a window. So let's say this day 14 I'm talking about is the day you are projecting. Still be active up to day 18. So still engage in sexual intercourse. And the more you engage in sexual intercourse about this period, the more you increase your chances of getting pregnant. So it's important you know your fertility window because when you know your fertility window, you can do one of few things, you can do one of few mathematics, and you can actually have a better chance of achieving pregnancy. Okay, so if you're not aware of your fertility window, maybe because you don't have a regular cycle, please engage in sexual intercourse every 2 to 3 days to help optimize your chances. So every 2 to 3 days within the period you're not bleeding, please engage in sexual contact about this time. When you do that, you have a better chance of achieving pregnancy. Remember, in every woman, pregnancy can occur anytime depending on your cycle. Some women have longer cycles, some women have shorter cycle. So depending on your cycle, some women that even engage in sexual practice during their menstrual bleeding can actually get pregnant. Very rare, but very possible. So the whole length of menstrual cycle in a woman can actually be a period she can get pregnant, but it depends on what's unique for you. Okay, so this is a very important concept you have to get used to by paying close attention to your body. If you're having problems with your ovulation, knowing when you ovulate, you can actually get some, apps or some ovulation test kits out there. So what ovulation test kit will check is the level of a particular hormone we call the LH. So LH hormone is the luteinizing hormone. This hormone will spike about the period you're about to have your ovulation. We call it LH surge. When it goes up, about 12 to 24 hours, you're likely going to release your egg. So that's what those ovulation test kit checks. So if you're using an ovulation test kit and you really, really want to improve your chance, once you get a positive indication that your LH surge is high, you engage in sexual contact by then. But remember, pregnancy and fertility can be very sensitive. So sometimes a whole lot of things I'm talking about will be okay, everything will be normal, but pregnancy won't still occur. But it doesn't mean you have to stop trying. You have to keep trying because the more you try, the more you increase your chances of getting pregnant. Be aware of cycle, be aware of thinking you know it all when you don't know. If you have difficulties in knowing all this stuff I mentioned, you can also go to your doctor and your doctor can help you figure out when you can actually increase your chance of getting pregnant. Okay, so thank you so much for tuning in tonight. Bye bye, and hopefully I'll talk to you soon.